Terry, why don't you give your introduction? Good afternoon. I'm Dr. Akram Boutros, President and CEO of the Metro Health System, and it is my pleasure to welcome you here today. Thank you for coming on this snowy day. Today, you will hear how Metro Health and the state of Ohio are preparing for a potential outbreak of COVID-19 or coronavirus. I'm joined here by Governor Mike DeWine, Director of Ohio Department of Health, Dr. Amy Acton, Cuyahoga County Health Commissioner, Mr. Terry Allen, and Metro Health Chief Quality Officer, Dr. Brooke Watts. For more than 183 years, Metro Health has been managing health crises that spread fear and alarm throughout our region. It all began with the Cleveland cholera outbreak in 1837. This was followed by a TB crisis in the 1900s, and later the polio epidemic of the 1950s. In the 1980s, we spearheaded efforts to address the spread and treatment of HIV and AIDS when contracting the disease was a death sentence. And when Ebola hit our shores 5 years ago, we quickly volunteered to become the state's only designated Ebola treatment center. Today, the center includes a special disease unit that focuses on emerging disease threats. We stand ready to treat COVID-19 should cases appear here. The Governor and Dr. Acton have met with our team and visited our special disease unit. We've discussed our preparation for COVID-19. We are honored to have Governor DeWine here. He has been a friend and ally when he was in the United States Senate, and a strong partner on the opioid epidemic as Ohio Attorney General. It is reassuring to all of us that this governor understands the health needs of Ohioans, and that strong safety net institutions like Metro Health are critical to Ohio and the United States. We are the first line of defense against emerging disease threats. Ladies and gentlemen, it is my privilege to introduce Governor DeWine.
Thanks, Doctor. Dr. Boutros, thank you very, very much for having us here today. We just finished a tour of the Emerging Diseases Unit to learn more about the preparations that are occurring for infectious diseases such as the flu and the coronavirus. What they do here at Metro Health is certainly very impressive, and Ohio is fortunate to have doctors, nurses, epidemiologists, and others committed to protecting our health and well-being from the spread of diseases. We are very, very fortunate to have that. So, Doctor, thank you very, very much. After I was elected governor of this state a little over a year ago, I asked Dr. Amy Acton to head our Department of Health. Since the beginning of the news about the coronavirus 6 weeks ago, Dr. Acton and her team at the State Department of Health have been engaged with our local and with our federal partners, preparing for whatever might come next. Dr. Acton updates me at least once, sometimes many times, every single day. She briefed our cabinet this morning again. And she has just returned last night after spending the last several days in Washington, D.C., where she has been working with her counterparts across the country, as well as officials from the Centers for Disease Control and Prevention, the CDC, and the U.S. Department of Health and Human Services, and the White House. The threat of the coronavirus in the United States and in Ohio remains low. And currently in Ohio, we have no confirmed cases. We have no confirmed cases, nor any persons under investigation. We have had 7 people tested for the virus in Ohio, and all of these individuals have tested negative. But we know that this could change, and so we have to be prepared. And all Ohioans must have a sense of urgency about this emerging health threat. And that's what I want to talk about today. It's imperative that we be open with the public and that we communicate information in real time about the coronavirus to both inform and educate the people of the state of Ohio. My commitment is that we will communicate what we know when we know it. That is our obligation, and that is what we intend to do. Certainly today, no one knows all the answers. No one does. Dr. Acton will share today with you what we do know so far, but we certainly cannot predict the future. And this disease continues to evolve, making it all the more important that as things change, we continue to work with our local partners to communicate information to the public. In Ohio, our Department of Health, our State Department of Health, works directly with 113 separate county and city health departments around the state. We work very closely and collaboratively with these local departments. They are truly the first line of defense in every one of our communities. The State Department of Health works with our local partners to provide guidance to them, to provide support to them, to give them information, and to help them implement their various programs. Also, our state health department works closely with our federal partners, the CDC and HHS, who offer technical expertise and funding for many of our programs. It is important to understand the role that the Ohio Department of Health and our local departments of health play in protecting our health here in the state of Ohio. The truth is that much of what they do, the average citizen never hears about, doesn't think about, because what they do is focus on prevention. What they do is focus on planning for an emergency. We have people in Ohio working hard every single day to make sure, for example, that our food is safe to eat, our water is drinkable, our swimming pools are clean, and our nursing homes are following safety guidelines to protect their residents. That work goes on every single day, out of sight many times. Their mission is really to diagnose and identify health hazards in our communities and then work quickly, many times quietly, mostly behind the scenes, to solve and help prevent health problems. Our State Department of Health and our local health departments across the state have teams of doctors and epidemiologists and emergency preparedness experts whose job it is to plan for outbreaks. This preparation is candidly part of their standard operating procedure. And in a moment, Dr. Acton will talk specifically about what Ohio has been doing for the last 6 weeks in preparation for a possible coronavirus outbreak, and what will happen if someone in Ohio does, in the future, test positive for the virus. As we continue this work, I have tasked my cabinet directors with implementing preventive steps to help minimize the threat and the spread of not only the coronavirus, but also the flu. Because the fact remains that Ohioans today are at a much higher risk because of getting the flu than from getting the coronavirus. Last year in this country, there were over 34,000 deaths caused by the flu. The CDC estimates that there have been at least 16,000 flu deaths in the United States so far just this season. And that figure might be as high as 41,000. Flu remains a major killer in this country. While we do not have data about how many adults have died in Ohio from the flu, we do know that there have been nearly 1,200 flu-related hospitalizations as of February 15th. And tragically, 2 children, both young girls here in Northeast Ohio, have died from the flu this season. A 16-year-old in Cuyahoga County and an 11-year-old in Lake County. As I said, the adult numbers in Ohio we do not have. And so as we outline the steps Ohioans can take to protect themselves from a possible coronavirus outbreak, it is equally important to take these very same steps to prevent the spread of the flu that we know is already here. Today, I have asked my cabinet directors to implement several very important steps in their agencies to help mitigate the risk of both the flu and possible coronavirus in Ohio. As a state, I believe that it is important that we lead by example. And so what I'm ordering today, I hope, does that. As far as the state is concerned, we run institutions, buildings, 2 veterans homes, 6 state hospitals, 9 lodges at our state parks. We have 28 state prisons in Ohio. So we have an obligation to ramp up what we are doing and to have that sense of urgency ourselves about what I'm asking all Ohioans to have, and that is that sense of urgency in preparing for what may be coming. So, here are some of the things that I'm ordering today. And I strongly encourage everyone else across the state of Ohio who runs businesses, who runs hospitals, nursing homes, schools, and other facilities, that if you haven't done these things already, to examine your existing disease prevention plans and consider additional measures. Now is a time to review what you're doing. Once again, now is a time for a sense of urgency. I am today directing the Ohio Department of Transportation to post information from our Department of Health in all state rest areas on hand washing protocols and to include messages on Ohio Travel TV. I'm asking our Department of Rehabilitation and Corrections and the Department of Youth Services to increase the frequency of and be very aggressive in the use of disinfectant measures in all their state facilities to protect the inmates, the families, and the staff. I'm calling on our colleges and universities, our college and university leaders, to urge every student, every faculty member, every employee, that if they have not yet received a flu shot, to do this immediately. Go to the campus health clinic and get these shots today. Further, I'm asking our college and university leaders to prohibit college-related travel to nations where the CDC has recommended no travel, such as China and South Korea. And for all Ohioans, please consider your foreign travel. Anyone thinking about foreign travel should monitor the CDC's travel advisory website for updates. This is updated every single day, and as this virus continues and what we know about it continues to emerge, this information, we can bet, will continue to change. Monitor the CDC webpage. It's very important to do that. I also am asking our colleges and universities to take appropriate action to accommodate students who are studying abroad and may need to come back to the United States in mid-semester or in mid-quarter. Help them make that transition. I'm asking the Ohio Department of Aging to continue to work with local aging networks to identify the most vulnerable older adults in our communities, those people who have the highest needs. We must make sure that we have plans in place so that their needs are met, whether that is providing additional meals or access to additional medication or other personal care needs. Also, I'm telling our local aging advocates across Ohio to go out into their communities to check on nursing care facilities to ensure that all illness prevention methods are in place. Again, I'm asking our nursing homes to have this sense of urgency. We will also be paying aggressive attention to common areas in state-owned and leased buildings, including significantly increased cleaning frequency of these areas, use of hand sanitizer stations in common lobbies and hallways. Further, I'm announcing that on Thursday of next week, we will be convening a summit in Columbus for our local public health department partners and for the health commissioners and for their staffs. I will also be asking my cabinet directors from our state agencies to be there for that as well. Though we continue to communicate with these health departments on a daily basis by phone and email, we feel it's important to bring everyone together in person to share information, review processes, procedures, consider possible scenarios and courses of action, what we would do under different scenarios, and discuss additional steps to help reduce the spread of disease. That meeting will focus on those things and more. Let me conclude by urging all Ohioans to listen to the public health and medical experts. They train for this, they're prepared for this. This is what they do every single day. We need to heed what they tell us. We need all Ohioans to help. And I know Dr. Acton is going to talk about many things that average Ohioans, all of us in our daily lives can do. But again, the basics. Wash your hands, avoid close contact with someone who is sick, and stay home. Stay home when you are sick, something that some of us find hard to do, I think. I urge Ohio employers and schools to be flexible if people are sick and encourage people to stay home who work for you. These are simple and effective ways that all Ohioans can help. Let me now, at this point, turn it over to Dr. Amy Acton, who, as I said, has really been immersed in this for the last 6 weeks, and someone who brings in her training and background a great background to lead our efforts in regard to the coronavirus, but also what we do every single day and our departments do every single day in regard to public health. Amy?
Thank you. Thank you, Governor. Thank you. Good afternoon, everyone. You see me a little sleep deprived. As the governor said, I just got back from D.C., where I spent a couple days really at the White House, talking to leaders there, working with the leadership of the CDC, and most importantly, talking to other states. It's wonderful to be here at a place that is, this hospital is so amazing in their work on infectious disease. So at the end, I hope reporters will also take time to learn more about what they do here. But I want you to know that our state stands ready. I know I say that, and I know at a time when there's a lot of information flowing and seemingly changing information, it makes it harder for people, everyday people, just to feel secure in what's happening. But this is something we really are prepared for. Infectious diseases are something we know. And even when there's a new infectious disease, they are predictably unpredictable. In other words, pandemics and spread of infectious disease happens in a phased way, and it happens in patterns. And so we really, while we might not know exactly where it might spread first or where the one case in Ohio might occur, we really know what to do about it when it happens. So I want to let Ohioans know that this system is working. And in fact, in looking around our country, I felt that we are very prepared. We've taken a very conservative, sort of aggressive approach, as is my nature, and we'll tell you more about that, especially in the question and answer. I want to answer a lot of details. But I want to think about what this feels like for people at home who might see this or hear about what you write. Again, coronavirus looks very much like the flu. What we now know, and we learn more hour by hour, is that it's very contagious. It's particularly catchy. In terms of its morbidity and disease state, it's a little more dangerous than the flu, but it's not as dangerous as things we've seen in the past, like you have dealt with here, like Ebola or SARS or MERS. It acts like a flu or cold. You have the symptoms of coughing, fever, body aches. In fact, there are many people who probably get it who will never know they got it, just like many people get the flu and never know they have it. But for people who are more vulnerable, the elderly, aging, people who are immunocompromised, they're more susceptible, just like they are to the flu. So those are the groups, we worry about most. What's different about coronavirus is we don't have a vaccine yet. And it will take at least a year to a year and a half for us to have a vaccine. And it's an amazing pace they're doing that. But everything we do in public health is to slow down the spread of this disease while we get to that place where we have a vaccine. The other thing is that coronavirus does spread when people are asymptomatic. That we've learned recently. So people can be catchy. And when we talk about these things you need to do, they sound so low tech, but they make a huge, huge difference in spreading it amongst people. So in Ohio, we currently remain very low risk. But as you see around the world, that can change, and we will definitely keep you informed. Everything that happens, we will keep you informed. There are no cases. There's no community spread. Up to the case we've heard about in California, that's the first person that they think may be community spread. And what that means is that they don't know for sure where they got it from. Did they get it from a traveler, or did they get it from someone who had a case? Up to this point, we've been able to say exactly where everyone caught it. Eventually, it will be impossible to keep up with that, and that's when we start to see community spread go. Of the people who traveled, you've also heard our numbers on Traveler, we have received at least about little over 200, 212 was the last number I saw, of people who have returned through the airports, 11 airports. Again, these folks are not sick, they don't have the disease, but we took a sort of aggressive stance in Ohio, and we asked that they would voluntarily self-quarantine, meaning stay home, watch a lot of Netflix, and work with these amazing disease detectives, what Terry is going to tell you about here at the local level, who monitor them every day. They monitor their temperature. They make sure they have food to eat. But we just ask that people stay home so that they don't spread it. But they don't have the disease, and most of them have already graduated out, not ever getting it. Every day we get a few more. Here at the state, we get those details from the Division of Global Migration and Quarantine, and then we share them with the local counties. About 33 counties have had a traveler that we know of, sometimes one, sometimes two. But that number will grow if we see more guidance about travelers from other countries. So that system is working. It's working very well. But if we had a case, we would come to you right away. So what would a case look like? Again, most of the cases in this country are at home. They're being monitored at home very similarly as to the people we suspect. They're not sick enough to be actually in a hospital. Right now, there is one person hospitalized. We know that most people will be miserable and take comfort measures like we do with the flu, but eventually it will pass. When it gets worse, they have respiratory distress most often. Sometimes in other countries, they've been put on a ventilator, and that's where you see people having more severe symptoms. But right now, the disease is really looking a lot like the flu, where you get that spectrum of people, mostly people who do well, but some people who might not. So that's my best way of explaining to you what it will look like when we see a case. Importantly, we surround that case. In a way, we take histories on folks that you wish your doctor still took on you. We ask you everything you have done, what you eat and drink, where you have traveled, if you sat on an airplane, what seat you sat on. We know everyone you have come into contact with. And then we go to those people you have come into contact with, and we talk to them. And some of those folks, like your family members, might be asked to self-quarantine and stay home as well. And we take those rings of knowledge out. Someday there might be a case who went to the movies, in which case we would publicly say that. We would say they were at the movies and saw, Spider-Man number whatever, and they were in this theater, and then people who were worried about that would have that knowledge so that they could go to their healthcare provider. The important thing about all of this is we will learn more hour by hour. And it's most important that you get your information from a good resource. So we have created, in addition to our usual website, we've made a more public-facing version of it called coronavirus.ohio.gov. And we're going to be putting on that lots of tips for just all citizens. Already on our website at odh.ohio.gov, we have tons of guidance for hospitals, businesses, schools, universities, kindergartens, daycares. And every time we get more guidance or learn more, have better tips, we put it on there. So I think it's very important in Ohio that we all go to the same information and all work from the same playbook. What are some of these things you can do? If you have a little prepper side in you, or just do what a lot of us do. I grew up in Northeast Ohio, and I kept in my car my blanket and my flashlight and my kit of things. What would your kit look like for coronavirus? So what you would think about is, what would it be like if you got sick and you didn't want to go to CVS because you don't want to expose other people? So you want to now, just make sure you have your basic cold symptom, kind of flu, aspirin, NyQuil, if that's your comfort measure of choice, whatever that is, you want to have those medicines. But more importantly, you might want to have whatever your regular medicines are. A 14-day at least supply at home. You'd want to have some food. You might want to think about your pets and make sure you've stocked up on pet food in case you're all of a sudden getting the vacation quarantine experience. And you might also want to think about your kids. A lot of us have kids, and your kid might get sick and be sent home from school. So you want to be thinking about what your plans will be in that case. Also think about your parents or your grandparents. Will they need extra help, and what you might do? So if you're hearing what I'm saying that you would do a lot of the things you would do worrying about your loved ones getting the flu and having backup plans. Again, information is just so important. You will work with your provider. You will work with someone from the local health department who will be giving you guidance and calling in on checking on you, so you won't be alone. That's the other thing. You will have more help than you've ever had when you got sick if you get coronavirus. Eventually, what else will we see here in Ohio? I prepare for the worst, so I'm going to share a little of my, what I think about and what I see coming and what my colleagues are really planning for around the country. We will see shortages of some of the preparedness, the PPE, what we use, the masks, the N95 masks, the gowns. There are worries about that already. We have a stockpile in Ohio, but the CDC is also working on creating a whole new, larger stash. Obviously some of these products are made in China, and as we know, they're not being made if people aren't at work. So all of those things are being troubleshot and problem solved at the national level. We really want people to get the flu shot because, again, you still are much more likely to be sick from that, but it will also confuse the picture of figuring out if you have coronavirus. So it really helps that you won't be going to the hospital with the flu if we're really trying to gear up our hospitals for a spread of this disease. So that's another thing that healthcare professionals are thinking a lot about. Another thing I want all Ohioans to think about is the stigma that has become associated with this disease. There's so much fear. This disease is a virus. It doesn't discriminate. It started in China, but viruses don't care who you are. They're going to spread amongst all of us. And so it's really important that, people are sick. And for those of us who aren't sick, we can help. Our faith-based institutions can help. If someone's homesick and they don't want to leave, take food and drop it off at their door for them. Those are things we can do right now early on. But this is something we should all do together. If we're businesses, we're going to have to be flexible. As the governor said, we're making plans because we run businesses, big state agencies. I have 1,100 employees. I'm thinking about what will happen when they get sick. And so making sure that you have those workplace redundancy plans in place, which again, many of us already have. But we also want to be flexible with telecommuting. Another option that we're doing a lot with now is telemedicine. I mean, the fact that you could talk to a doctor, and many of us have that in our health plans without ever having to leave our houses. I want you to know that we will be working on this 24/7 as we have been since it started. We will give you good information. When I say this is the flu and washing your hands is what I'm saying, I'm not saying don't think it's important. I'm trying to really tell you what it is like. That washing the hands that I always say, studies from H1N1 showed that when they implemented twice a day, 20-second hand washing in schools and wiping down surfaces, because this virus is easily killed by just routine cleaning products, there were 50% less cases transmitted. It was that less transmission. So it actually is something that works. What we're trying to do is just not get each other sick. Our citizens have been great. The people of quarantine have willingly done so, and that's what we'll need too. We do things if we need to quarantine places, and if we ever did need to give orders about a school closing or public place, we would do it, and you would see all that coming gradually. But most people do the right thing and stay home when they're sick. So that's the picture of coronavirus right now, and we'll keep you very up to date. And I'll now turn it over to my colleague, who's one of the most amazing, if you don't know it, in Northeast Ohio. Terry Allen he's a rock star around the country as a health commissioner, and I'd like for him to share with you what it really looks like, because most of the work in public health happens at the local level.
Thank you. I have to tell you, first of all, that's the first time I've ever been called a rock star. I have twin boys, and they would vehemently disagree. They're 18 years old. Thank you. Probably the last. Thank you very much. First, I want to say, Governor DeWine, thank you for being the consummate public health governor. You've supported protecting our kids from tobacco products. You're supporting our work around lead poisoning prevention. You're here today and supporting the work of public health, and that means a lot. It's very gratifying to us and my compatriots around the state of Ohio. So the one thing I will tell you is that state and local health departments are peas and carrots along with CDC. We're like the public health safety forces. We're like a utility. We're like water. We're like electricity. We're here to assist behind the scenes. Risking a football metaphor here in Cleveland, we're like a good defensive back. If we do our job, our name never gets called over the PA system. So that's what you need to know about public health. For Dr. Acton, she's been an incredibly fantastic leader, overbrimming with sincerity, and her support for local public health, her rallying the public health system statewide has been exemplary, and I'm personally very grateful that she's the state health director and that Governor DeWine has chosen her for that position. So what are we doing in local public health? I'm going to talk about 4 things that we do. We identify, we diagnose, we isolate, and we contact trace. So I'm going to talk about those 4 things. You're here in a treatment facility, and Dr. Boutros can explain the great work that goes on here and the fantastic people that work here at Metro. And in Cleveland, we're very fortunate to have a very strong medical system. So let's talk about identify. So Dr. Acton described the fact that we have travelers that are returning from different places. We know who those folks are, working with our state health department and CDC. They're cooling their jets for a couple weeks as they wait through their quarantine period or their isolation period. We watch for symptoms. If need be, if it occurs, there would be a need to then move from that identification process to diagnosis. So they're being watched, we're checking their temperature, we're looking for symptoms, and we're staying in touch. This is happening across the country. It's happening in Ohio. It's happening here now. The diagnosis would mean that if we had a person in particular that started to exhibit symptoms and based on the case characteristics, that person would need to be tested. We would coordinate with the state health department and CDC and with our hospital systems around the testing, and then those tests would be sent to the state health department and on for confirmation as needed. We also know that if we have people of particular concern, we can isolate those folks or quarantine. People that are specifically at risk can either be isolated or quarantined through different methods, but that's happening now. If we have a traveler that's sick, they're at home. They're not walking around the community exposing people. So that process is taking place. It's important to note that we've been doing this a while. I've been in public health for 30 years, and I was active around the post-9/11 response for anthrax, smallpox. We certainly then had H1N1 response in 2009, 2010. We had the blackout in early 2000 and how we dealt with that around a public health emergency. We remember that. And Ebola in 2014. So there's a lot of experience with understanding the shoe leather public health work. This is what we do. It's in our DNA. The last piece is contact trace. If we identify someone that's ill, and Dr. Acton spoke to this, we're going to identify someone that's ill and then find out who they've been in contact with. This is what we do for things like measles. This is very much part of what public health and medicine does. We look for people that are ill and find out who they've been in contact with and make decisions about whether those folks need to be isolated or tested, as the case may be. So what we're doing now is we are hoping for the very best, but planning in the event that it gets more severe. That's what we need to do because we don't know where this will go. Here locally, it's important, along with the 6 weeks you heard from the State Health Department, it's important to know that we've been working very closely with our partners here. We've been working with our hospital systems, we're working with EMS, we're working with fire, we're working with police, we're working with our school systems, businesses, and our county emergency management agency. If there was a need to escalate, we're already in the process of gearing up that system. And it can be tiered based on the need to expand based on the circumstances. And we are amidst the flu season, as Dr. Acton described, and certainly Governor DeWine described as well. And what we know here is just in the last 3 weeks, 10 people in the last 3 weeks have died from the flu. We've had 1,500 emergency room admissions, 500 hospitalizations in 3 weeks. So flu is alive and well here, and these symptoms are similar. So we need to bear that in mind. Get your flu shot. Talk to your doctor if you have the flu about antivirals, and Dr. Ray can talk about that in great detail later. So we don't want people to be scared. We want people to be ready. We want people to read the information and understand issues around social distancing and staying home when you're sick. And there's a range of interventions that could be escalated based on the scope and magnitude and tiered based on the scope and magnitude of an outbreak. The last thing I will say is, on a personal note, I haven't been in this unit in 3 years. And the last time I was here, I have a brother who's a fireman. And he fell 25 feet. And he was in the ICU for multiple weeks, and he had multiple cranial fractures. And he's back at work because of this facility. So thank you.
Thank you very much. Before we get to questions, I would like to have asked Dr. Acton to add a couple things. Dr. Acton, could you give the webpage again for anybody who wants to look up in Ohio about and continue to be informed every single day about Corona? And then if you could also amplify a little bit in regard to the mask you were talking about.
Thank you, Governor. So Coronavirus, the disease, is now being called COVID-19, and then there's actually another name for the virus, but most people are still knowing it as coronavirus. So the website is coronavirus.ohio.gov. coronavirus.ohio.gov. It is such an honor to work with a governor who cares so passionately. Like he goes into the details of this, and he just said, you haven't told them about the mask. So a lot of people do. I mean, so the masks, you know, most masks that people wear, the surgical masks, they can keep you from coughing. This is spread by respiratory droplets, so it keeps that from going out. It actually, many masks are not small enough and pore to actually keep viruses from coming in. So it's more to keep you from going to other people. Now there's a special mask called N95, and that's what we use medically, and that means it keeps out 95% of viral pathogens. And those are the ones that are crucial. Oh.
He says you want a whole one.
Yes.
N95, and here's a surgical mask.
Okay, so you're seeing, I mean, they even have emoticons now, right? The smiley face has a mask. Have you seen that one? This is the mask that it is wearing. And so, you know, and in many parts of the world, because I'm a global health doctor, people wear these out of politeness. It's not seen polite to be coughing around. You know, we all cough on each other, but in other countries, people are very careful about spreading disease, and so they're using that. You've seen paint masks from the hardware store. Those definitely aren't helping. The N95 is it has to be actually fitted. It's a very exact fitting thing, and if the fit is not right, it also is no longer good. These are essential for our healthcare providers to have. Sometimes masks have been given to family members of a case in some of these first cases because they live at home and they're trying to keep a family member from getting it. But these will be the ones that we see a shortage of, and it's really vitally important then that we keep them for the medical professionals and the real patients who need them. And in addition, we are actually working with hospitals and the CDC is working with all hospitals around the country on how to best conserve these. So it's actually a science to how we use these. And that's why you hear a lot about the masks. Again, for most of us, you know, it is the hand washing and the coughing into your sleeve and not spreading things and staying home and not spreading it to other people. So I hope I did justice. These, yeah, too. And one other thing, the governor, I've talked a lot about, testing is a big issue with this, of course. So, you know, we have a state laboratory, and eventually we will, hopefully, I've had rumors of the next about week or so have the test in Ohio, so that what happens is when we do get a specimen from the hospital or from a local health department, it comes to my lab and we ship it to CDC, and the turnaround time right now is about 3 to 5 days, and they prioritize those on the riskier cases. And the CDC has actually opened up a second lab, so they're running those pretty quickly. The CDC did try to get these already out to the states, but it's a PCR test and one of the reagents didn't work right, so they had to go back to the vendor who made them and have those redone, and so that's the delay. That will be obviously nicer because we'll be able to know quicker the answers, but we still know them fairly quickly, and to date our 7 people have tested negative. So I think with that,
Yeah.
it'd be good to open up to questions.
Be happy to answer any questions.
Dr. Acker, you said when you see a case, not if we see a case, do you think the spread here is inevitable?
So there was a lot of use of the word inevitable yesterday, and the fact is, all along, when you look at a pandemic curve, and then the spread of viruses, it's very, very hard to actually contain them and keep them from spreading. And we've done really a heroic job of doing that, but the goal all along has been to slow down the spread. You know, with the amount of travel we have, and with the infectivity of this disease, it has been suspected all along that it eventually could spread. You never know for sure, but I think we now are seeing that it is in so many countries. And eventually that will spread here in the United States. We will see cases, and we've always assumed we would. But we've done an amazing job, I have to say. Compared to each infectious disease, it gets a little better, and we've done a very good job.
Will we see cases in Ohio?
Well, you know, most likely, eventually, we will. But when, we don't know.
Governor, are you prepared to quarantine off Ohio communities if there's an outbreak of specific?
Well, I wouldn't want to speculate. That's so far down the path. You know, look, we're going to listen to what the experts tell us. So this is going to be something that any decision about any kind of order coming from the governor is going to be in consultation with the experts, certainly starting with Dr. Acton. Dr. Acton, you want to make any comment on that?
I think when we think about quarantine, there's a whole range of options, and so I want to try to make you imagine this. You know, most like that first case is in a community. So say it is in Cleveland, and maybe the case had a family member that then gets ill as well and is at school. That school is prepared. They have infectious diseases all the time. They have plans. And we've had several schools close in Ohio just because so many people caught it, and the faculty started getting sick, and there are not enough substitutes, and eventually they close a school. So there's a range of things. Like an individual school could close because it really stays contained to that one school or that one community. What you're speaking of is if we saw multiple cases and widespread in the state all at one time, then we have other decisions we would make about, you know, it might be best if what you see in Japan right now, that all schools close for a while because it's everywhere. They can't say it's one place. So there's a range of options, and we'll deploy them.
But we're not going to go too far down the path speculating, because again, the facts are going to control what decisions are made. These are decisions that are going to be made based on the facts that we see every single day. And so I can assure you and the people of the state of Ohio that Dr. Acton and I and her team are in contact every single day. Just as important, she's in contact with local authorities, and collaboratively they're going to review the situation every day. So I think it would be very misleading to the public for us to sit up here or stand up here and come up with every conceivable scenario of what we would do under those circumstances. I think we have to let the facts play out.
You know, I think we're always afraid of what we don't know, and a lot of what the governor has been doing over the past month is, here we have this virus that, you know, the flu that we know killed 35,000 people in the United States, 61,000 the year before, and you know, we sort of are complacent to that, to the point where we don't think about it. But coronavirus is new, and it's tricky because we learn something new every hour. So that leads to sort of a feeling like this must be something we can't anticipate, and I think that's why. So I'm not saying that people shouldn't be concerned, but I want them to have some sort of context for that concern.
And many, to reemphasize, many of the things that we are recommending, the doctors recommending, the health authorities are recommending, is also good for the flu. And the flu we know is here, and we know the flu is a killer. So doing these things is the prudent thing to do. It's not an alarmist thing to do. It's not, thinking anything other than let's minimize the risk for every Ohioan. Let's save lives. And by doing these things collectively, we will clearly save lives.
To support Dr. Acton's comments and the governor's comments, a study out of China of 45,000 people showed that 80% of the cases were very mild. So it's important to understand that we start to talk about flu. Who are we most concerned about with flu? Dr. Acton will tell you people with chronic diseases, people with reduced lung function or immune suppression. So we need to think about those same people at risk if it were for the flu, right? So we need to think about it in that context. It is cold and flu season. Think about the most fragile folks in our community and think about what we can do to protect them and support them. And those are the folks that should be seeking care. I'll allow Dr. Boutros to talk about that from his facility standpoint. But certainly we want to make sure that the hospital is able to serve those that need the assistance most.
Anybody else in the news media? Yes, in the back, clear in back.
Yeah. Thank you for that question. I would say of all the things, and I've been at this over 30 years now, the thing that it most feels like to most of my colleagues as well is H1N1, which means we're kind of in for a long haul. And as you know, with H1N1, there eventually was a vaccine. So I think if you look back, and a lot of our colleagues, there's an excellent MMWR from 2017 that takes all the lessons learned from H1N1, and you can be certain those are all things that we're implementing now in this situation. So very, very similar.
So in terms of the tests, who is responsible for the cost of this test? Someone who's suspected of having coronavirus.
That's a good question, and for some people, insurance is covering it, but we will get the test done. We have funds set aside, so we will make sure there will no one who needed a test that won't get a test.
So what happens if someone refuses self-quarantine? Jurisdiction is there? Is there
Yeah.
a protocol in place? If I just say,
Yes.
not going to do it?
Right, so we do have public health laws, and we have researched those as we always do. You know, I've used some of those laws when we had a Legionella outbreak. So we do have that ability at the state and local level. Usually local goes first, and again, most often people comply, but there are situations, as we saw, you know, even with Ebola or measles, where, you know, we do have that ability to protect the public through quarantine. The state has that ability as well.
Where would you put those folks?
Well, housing is a very important issue, and that is a big part of our strategic planning, because again, if you do have to quarantine someone, what do you do if someone is homeless? What do you do if someone lives in a house with a lot of people and they don't have that? And you can see some of this already happening in the other states. They're using, you know, places that the state has available. Often hotels have been used, or, you know, but we will find housing and we have resources. I should say that Congress right now is looking at, you know, a special emergency appropriation, and a lot of that funding will be to support, if there was a need for larger quarantine, it would be for housing, for transportation needs, for wraparound like food for people. If someone is quarantined, we are obligated under law to provide for their needs.
Last question, the governor has to go, we'll have some more folks who stay behind for additional questions about the project.
We've got, you know, St. Patrick's Day in the primary community, where there's obviously going to be a lot of human-to-human contact. Do you guys have any kind of plan for that, both locally and statewide?
Well, I think that's a good point. I think I've not talked to the Secretary of State about this, but I would hope that there's an advisory put out as far as sanitation, sanitizers at polling places across the state of Ohio. Again, these are things that, as we think of them, we're going to add them. I think that's an excellent idea.
Thank you, Governor DeWine.
What about for St. Patrick's Day when you've got, you know, thousands?
Every bar should have one, yes.
That's something to end on.
So thank you, Governor. Thank you, Dr. Acton, for coming.
Such an honor.
And thank you all for being here. We're going to stick around. We're going to have some of our medical personnel to answer any additional questions for you. But I want to thank you for being here. And